Hello, everyone. My name is Joe Kelly, the Community Relations Program host at the Rochester Hills Public Library, and I'd like to welcome you to this morning's presentation, Ascension Health Talks, Skin Cancer Awareness During the COVID-19 Pandemic with Dr. Stacie Clark MD. Before we get started, we'd like to thank the Friends of the Rochester Hills Public Library for supporting our programs through their many fundraising efforts. We greatly appreciate their support. You can register for our upcoming programs by visiting calendar.rhpl.org. Our next program will be an evening with Joe and Rose Kennedy on Tuesday, October 20th at 7 p.m. So we'll hope you'll join us then. Today's attendees will remain muted throughout the program. You are, of course, encouraged to ask questions using the chat feature on Zoom. The program will be recorded and available to view on the library's YouTube channel 1 week from today. This program is in partnership with the Ascension Providence Rochester Hospital, and I will now introduce Stephanie Bauer of Ascension's Community Health and Education Department.
Thanks, Joe. Hello, everybody. I'm Stephanie Bauer. I'm a nurse coordinator, like Joe said, in the Community Health and Education Department at Ascension Providence Rochester Hospital. That's a mouthful. It used to be Crittenton. Everybody knows the hospital right in town. So thank you all for coming today for this important topic. I want to thank, obviously, Rochester Hills Public Library for hosting. We couldn't do this without you, so thank you so much. Today's presentation, Skin Cancer Awareness During the COVID-19 Pandemic. This presentation is just to really help you care for your health during a time when it's really hard to get to the doctor and do your routine skin cancer screening. As many of you know, at the hospital, we have, I think for 30 years now, have done a free skin cancer screening event. And it's typically in May, and this is the first year we weren't able to do that. And so this presentation, we want you to gain some confidence and knowledge on the steps that you can take to protect, self-examine, and care for your skin. So I know there's only a few of you here today, so hopefully you can spread the word as we record this presentation, and again, just share this information with them. We hope to be able to do those free skin cancer screenings in the future for sure. So just so you know, we're going to be having the chat feature available for anybody who has questions for Dr. Clark. We'll be happy to present those to her at the end of the presentation. And obviously, as with the recording, that'll all be included. And then just keep in mind that we have one more virtual program at the end of this month on October 29th at 7 p.m. with Dr. Decker, an orthopedic surgeon, and this is on foot and ankle surgery, so really good topic as well. But now I'd like to introduce Dr. Stacie Clark. She is a board-certified dermatologist who practices medical, surgical, and cosmetic dermatology at Pinnacle Dermatology in Rochester Hills. She got her Bachelor of Science in Physiology at Michigan State, graduating with honors, and then she received her medical degree at the College of Human Medicine, also at Michigan State University. She received multiple awards and scholarships during her undergraduate and graduate training, and the most distinguished including admittance to the Alpha Omega Alpha Honor Society. Now, after completing her internship at Ascension Providence Rochester Hospital, she went and completed her dermatology residency at Rush University Medical Center in Chicago, where she served as the chief medical resident during her final year. Throughout her training, she participated in multiple research projects to help advance the field of dermatology. Dr. Clark takes great pride in providing exceptional patient-centered care, spending time to educate her patients about their individual skin conditions. I'd like to extend a warm welcome to Dr. Stacie Clark.
Thanks, Stephanie. Good morning, everyone. Thanks for joining me. Let's see if I can get my presentation started here. All right. And again, thank you to Ascension and to Rochester Hills Public Library for having me. It's a pleasure to be here this morning. I wanted to speak with you today about skin cancer awareness and screening, and really just how to navigate dermatology during the pandemic. So today we'll begin by reviewing how the sun damages your skin and how that damage can lead to different types of skin cancer. We'll also touch base about how individual risk factors for skin cancer can influence your personal risk and how you can go about lowering your personal risk. And lastly, we'll talk about how to spot skin cancer early through self-screening techniques. And we'll also briefly discuss what dermatology visits look like during the pandemic. So how does the sun damage your skin? The sun will radiate energy over a broad spectrum of wavelengths, with UV radiation having the shortest wavelength, shorter than visible light, and that is what's responsible for sunburns and other health effects. UV radiation is comprised of 95% UVA and about 5% UVB. And those UVA rays are what cause sunburn, immediate tanning, aging of the skin, and skin cancer. UVB also causes sunburn and skin cancer. And for reference, if you're thinking about self-tanning beds, they emit up to 3 times more UV radiation than the sun, which is why they can be so harmful. A suntan occurs when the skin's pigment-producing cells, also known as melanocytes, develop more melanin or pigment to protect the skin. This pigment lends a very small amount of protection against sunburns. Any prolonged exposure to UV radiation, even with that so-called base tan, will still damage the skin and can lead to skin cancer and premature aging. The risk of melanoma, which is the most deadly form of skin cancer, is reported to be more than 2-fold higher with a history of just 5 or more sunburns during adolescence. And if just one of those sunburns is blistering, that more than doubles your chance of developing melanoma. So how exactly does that UV radiation then contribute to skin cancer formation? So once the UV rays penetrate the epidermis, or the outer layer of your skin, those rays come into contact with the skin's DNA or genetic material, and that DNA is damaged from that exposure. So the skin's immune system tries to correct that damage. Unfortunately, it's an imperfect system, so mistakes or mutations can occur. And those mutations are what tell the skin cells to reproduce over and over, and that leads to skin cancer. It's important to note here that this is the most common way to develop skin cancer. Sun exposure will certainly lead to skin cancer, but it can occur even on protected areas of the body. You don't need to have sun to develop skin cancer. So we'll move on to the most common types of skin cancer. In the United States, more people are diagnosed with skin cancer each year than all other types of cancer combined. It's estimated that 1 in 5 Americans will develop skin cancer in their lifetime, and the incidence rates of all types of skin cancer continue to rise each year. Fortunately, most skin cancers, when detected early, are easily treatable. So basal cell carcinoma, this is the most common type of skin cancer. It's more common in fair-skinned individuals, but it can happen in everyone. It usually looks like a skin-colored bump that won't heal, as you can see in the top picture there, or even just a red scaling patch that won't go away. It tends to grow very slowly, and it seldom spreads. And fortunately, when found early, this is a highly treatable form of skin cancer. Squamous cell cancer is the second most common form of skin cancer. Squamous cells are found pretty much everywhere throughout the body. They line our organs, they form the epidermis, or the outer layer of skin. And anywhere that we have squamous cells, we can develop squamous cell cancer. On the skin particularly, squamous cell cancer can arise from a precancerous growth called an actinic keratosis, which usually feels like a rough patch on the skin. They can also develop independently without a precursor. Again, squamous cell tends to grow slowly, but it can grow more deep into the skin and has a higher risk of damaging nerves and vessels and underlying tissue structures. Again, though, when we find this early, it can be easily treated with surgery. The third most common type of skin cancer, but unfortunately the most deadly form of skin cancer, is melanoma. As of 2017, melanoma was the 5th most common cancer among men and the 6th most common cancer among women, and the incidence in both groups is continuing to rise. Melanoma is usually dark brown, dark black on the skin, but it can be any color, including red or white. It might arise from an existing mole on the skin that has changed, or it can be a brand new growth on the skin. This type of cancer spreads early and more quickly than other forms of skin cancer, so early detection is key. It can be difficult to treat if it's not caught early. So we'll take a look at a few individual risk factors for developing these types of skin cancer. And there's 3 main categories to think of when you think about personal risk for skin cancer. These are genetics, or who you are, environment, or where you live and work, and your behavior, or what you do. And any of these 3 factors alone or combined can increase your risk for developing skin cancer. So genetic risk factors, unfortunately, there's not a lot that we can do to change these things. These include being male, having naturally blonde or red hair, having light eye color, having fair skin. Skin that burns more easily definitely increases your risk. So in dermatology, we categorize skin type on a scale called the Fitzpatrick skin type scale, and you can see that on the right of the screen here. Any skin that falls into that type 1 or type 2 category that burns easily is going to increase your risk of developing skin cancer. Having many moles or having larger moles or having a family member who has had melanoma, all of those things will increase your risk. And then immunosuppression, which can either be inherited as a genetic condition or acquired through certain medications like chemotherapy, can also increase your risk of developing skin cancer. Environmental risk factors, so living at a higher altitude produces a thinner atmosphere. There's more UV exposure in these areas, so places like Denver or out west are going to have higher risk for skin cancer there. Living at a lower latitude, closer to the equator, creates more intense UV radiation and can certainly increase your risk as well. And then living in an area where there are more sunny days creates more UV exposure. Of course, in Michigan, a lot of these factors don't apply to us, but I'm sure most of you can agree that when we do have sunny days, we take advantage of those. That may involve going out on the water or going out skiing. Both of those activities, being on water or snow or highly reflective surfaces, can increase our risk as well. The UV radiation is more intense. So even with Michigan's unpredictable climate, we still do have those environmental risk factors. And then lastly, behavioral risk factors. There's a handful of these that can contribute to your risk for skin cancer. So of course, sunbathing or unprotected time outdoors will increase your risk. History of tanning salon use or history of severe sunburns also will significantly increase your risk for cancer formation. So how do we go about preventing skin cancer and lowering our individual risk factors? So most importantly is protecting your skin from the sun. So limiting your time in the sun is important. You don't have to avoid going outdoors, but you want to avoid intense midday sun between the hours of 10 a.m. and 2 p.m. when the UV rays are the most intense, and seek shade whenever possible. As I mentioned a few minutes ago, using caution near water, snow, and sand is important. These are reflective surfaces that will increase the intensity of the harmful UV rays. And then also sun protective clothing, wearing lightweight or long sleeve shirts and pants when possible. And there are now a lot of brands of clothing on the market that have UPF ratings or ultraviolet protective factor ratings. You want to search for a UPF rating of 15 to 50. For reference, a plain white t-shirt has about a UPF rating of 5, so you need a little bit more than that. Wide brimmed hats, sunglasses are also going to be helpful in protecting you from the sun. And then, of course, sunscreen. This remains an important way to protect yourself from the sun. Your sunscreen should have an SPF of 30 or higher. It should be water resistant or broad spectrum, which means it blocks both UVA and UVB. There are two main types of sunscreen. Chemical sunscreens reflect UV rays off of the skin. They're easier to spread. They don't leave that white residue on the skin. And then there's physical blockers like zinc oxide or titanium dioxide. These absorb UV radiation and they prevent skin damage, but they do tend to leave sort of a white tint on the skin. However, they are better for sensitive skin, so there's definitely a role for these as well. One of the more common problems that we see with sunscreen is improper application or just not using enough sunscreen. So the rule of thumb is that most adults need about 1 ounce or a shot glass size to fully cover your entire body. Sunscreen should be applied about 15 to 30 minutes before going outdoors, and it should be reapplied every 2 hours or after swimming or heavy sweating. So we'll shift gears a little bit and talk about how we spot skin cancer early and how to examine your skin at home and what you should be looking for when you do that. So self-examination of the skin is a very important screening tool. It should be done once monthly at home. There are a lot of different approaches to self-examination of the skin. This diagram outlines one approach. You'll find similar diagrams if you look online, but what you want to do is start by examining the front and the back of the body in a full-length mirror. And then you bend your elbows, looking at the forearms and backs of the arms, look at the palms of the hands. Then take a seat, look at your feet, look between the toes, look at the soles or the bottoms of the feet. Move on to the neck and the scalp, the lower back and the buttocks using a hand mirror. I'll be honest, this isn't my favorite approach to self-exam. It involves a lot of acrobatics. It's tough to do this. It's tough to see your own back. So usually I counsel my patients to ask for assistance with skin checks. It's much easier to have someone help you do this. You can ask a loved one or a close friend to help examine those difficult to see areas like your back or your scalp or other places that you can't see. Better yet, have them take photos of each section of your skin, and then you have a baseline. Once a month, you can compare your skin to your baseline photographs and see if anything has changed. A lot of people have cell phones or digital cameras, so it's an easy way to map out your skin. I also frequently encourage patients to have their hairdresser, their hairstylist, take a look at the scalp. Usually you have routine visits with them and they can look for things that might be new or changing. If you don't have someone that can help you, you can always try this method, try to keep an eye on your skin. And of course, you can always come for a free screening or come to the dermatologist, and we can always help you look as well. So what are you looking for when you're looking at the skin? The American Academy of Dermatology has created this set of criteria called the ABCDEs to help identify skin cancer early. They recommend looking for the following 5 things. A stands for asymmetry, meaning one half of a mole or growth on your skin is unlike the other half. B for border, any irregular or scalloped or poorly defined border is atypical. C is for color that varies throughout the growth. This could be brown or black, but like I mentioned earlier, for melanoma, this could be white, this could be red, or even blue. D is diameter. So the classic rule of thumb is that anything greater than 6 millimeters, which is the average size of a pencil eraser, is concerning. But this is a rule that's not really hard and fast. So a lot of skin cancers are diagnosed at a much smaller size than this. So keep that in mind when you're looking at the skin. And then E, which in my opinion is the most important out of these criterion, is evolving. So anything on the skin that looks different from the rest of the growths on your skin, anything that's changing in size, shape, or color should be evaluated. And while this is a helpful tool, it's a good place to start. It's not the only way to monitor your skin. You should also be on the lookout for red patches or bumps on the skin, sores that are bleeding or won't heal, itchy or painful moles, or of course any new moles that pop up. And if you're unsure, it's always better to ask a dermatologist who's trained to look and diagnose and treat all of these different growths on your skin. So I'll wrap up by just discussing dermatology and medical visits during the pandemic. And the question is it safe to see a dermatologist or any physician for a cancer screening during the pandemic? And the short answer is yes. It's really important not to delay care and to continue to take care of yourself, even in this uncertain time. If you're uneasy about going to the doctor, call ahead and ask if telemedicine is an option. Certain skin conditions are really easily evaluated through an online visit, and you can stay at home for that. So dermatology is unique in that most of the things that we diagnose are easily visible on the skin. And so we can see you through a virtual visit through a platform just like this, and we'd be able to take a look and establish care. You may still have to follow up in person, but it's an easy first step into getting skincare during the pandemic. If you do decide to come into the office, there are a lot of safety precautions in place. On the day of your appointment, you might encounter a few new policies or procedures. In my office, for example, and I'm sure in most offices, you'll be asked to wear a mask. You will have your temperature taken upon arrival. You'll be asked to answer a brief COVID questionnaire. You may be asked to wait in your car until your appointment time, just to limit the number of people in the waiting room. And if you do come, it's important that you limit the number of people that you plan to bring, just so that we can keep everyone as safe as possible. There's frequent cleaning of public areas in the office. Our exam rooms are cleaned and sanitized before and after every appointment, and providers and staff, of course, are all wearing personal protective equipment. So it might look a little bit different when you come to the office, but you're still cared for in a clean and safe environment. So with that, I think I will wrap things up and welcome any questions from the audience.
All right, thank you so much. Wow, I learned a lot from that presentation already. So thank you, Dr. Clark. This is great. So we do have a couple of questions came in.
Sure.
The first one is, does having Parkinson's disease increase your risk for skin cancer?
So specifically, Parkinson's does not increase your risk for skin cancer, but certain medications that you may be taking for Parkinson's could. And it's always a good idea to just come in for a baseline evaluation. We recommend that most adults come in at least once a year to get a baseline screening, kind of map out the skin. And then that way, when you come back in each year as part of your routine screening, we know exactly what growths look like on your skin, and if anything new or changing has arisen in the past year.
Okay, interesting. So what about using face lotion? So I personally wear a face lotion with SPF, but I don't reapply throughout the day.
Sure.
I just put it on, and then I put my makeup on, and then I go about my day. Is it still effective even though I'm not reapplying throughout the day?
Great question. So most face lotions these days, and a lot of makeups, will have SPF built into them. As long as it's an SPF of 30 or higher, that's great. It should be going on every single day. If you use a moisturizer or a lotion that does not have SPF, you should be applying an individual sunscreen on top of that moisturizer. If you're just going about your normal business throughout the day, working inside or going outside briefly, that SPF is enough to last you throughout the day. You don't need to reapply. However, if you plan to go to the beach or spend your day outside, then you should be reapplying, following those rules that we talked about earlier, every 2 hours, or if you have been heavily sweating or exercising or swimming, then it should be reapplied following each of those activities. But on a day-to-day basis, as long as something is going on in the morning, that's more than enough protection to get you through the day. And it's important too to remember that even on a cloudy, overcast day or in the middle of February, you should still be getting sunscreen on the skin. UV will still penetrate that cloud coverage, and while the UV index is a little bit lower, it can still damage your skin. And so every day is a good day for sunscreen.
Okay, good to know. That's wonderful. Thank you. Now, a question about UV light came through. Is there any benefit to UV light, skin issues such as eczema or psoriasis?
Yeah, that's a great question. So we actually use UV light in the treatment of some skin conditions, surprisingly, but we use it at really judicious doses. So we don't kind of go out into an uncontrolled environment, and we specifically use UVB light to help treat some conditions. However, it's usually for less than 10 to 15 minutes and in a calculated dose to help treat those conditions. We do often tell psoriasis patients that going outdoors for a few minutes without sunscreen is okay, just to help treat their skin condition, but again, no longer than 10 to 15 minutes. And after that, you would want to apply sunscreen to prevent any of those harmful effects that we talked about. So there certainly is a place for UV in the treatment of some skin diseases, but we still need to be protecting the skin in most cases.
Okay, great. Now, do you have a recommendation on a spray sunscreen versus traditional cream? Do you have a preference?
So I tend to prefer a cream more than the spray. The issue that we run into a lot with sprays is just getting the sunscreen where you want it. So if you're outside on a beach on a windy day, more of that spray is going out in the wind than actually getting on your skin. So I do tend to prefer a cream over a spray. If you use a spray, just make sure that once you spray it on, you're actually rubbing it in to make sure that you're getting the coverage that you want.
Good, good. As a mom, I've learned a lot from just that question.
Yeah.
Because I will say I tend to spray the children on the beach because the sand is everywhere. And I feel like, and I don't necessarily rub it in because I don't want to rub it off. So I've learned a lot from that. So thank you.
Sure.
So a couple more questions are coming in. This is great. So I want to make sure I pronounce this correct. Is it Subariat keratosis? Is that right? Or
Subariat keratosis, yeah.
Yeah, there we go. Does that ever turn into skin cancer?
Good question. So no, Subariat keratoses are a totally benign growth. It's just an overgrowth of the top layer of skin. They can look concerning. They look rough and raised. They can be very dark brown or dark black and can be concerning when you start to notice them on the skin. So it's never a bad idea to come in and have these spots checked out so that we can confirm that they are totally benign. But no, in particular, that growth has no potential to become a skin cancer.
Good, good, excellent. This says, what would you consider to be a common myth or misconception you see about skin cancer or skin health that you'd like people to be aware of?
Oh, that's a great question. I think one of the bigger myths is that skin cancer only arises on sun-exposed areas. So that's certainly true for most basal cells and squamous cells. We see those very, very commonly on the head and neck, upper extremities, upper back that have gotten a lot of sun exposure. But in particular, things like melanoma, while the sun certainly plays a role in developing melanoma, genetics also plays a very large role. And so we've diagnosed, and I personally have diagnosed melanoma on the bottoms of the feet, between the toes, in private areas. So covered areas that have never seen the sun can still develop skin cancer. So it's important that you're looking in all of those areas and not sort of falling for the misconception that it only can be a skin cancer if it's on a sun-exposed area.
Wow, that was one of my questions as well. So very interesting. I definitely have heard of people getting skin cancer in an area that really has very little, if any, skin or sun exposure. So that's and then when you said checking between the toes, that made me think.
Yes,
that's
a lot of people have moles there, so it's an important place to look.
Very, very interesting. So what is the best way to treat tinea? Is it versicolor? And does it go away, or is it always present once a person gets it?
So it can go away, but it does like to recur. So tinea versicolor is a fungal infection of the skin. We usually see it after sweating or working out or warm weather. It tends to come up on the chest or the back. Easily treatable. You could start by using an over-the-counter anti-dandruff shampoo, but it does tend to be a little bit stubborn. So easiest to kind of come in for an appointment or even a virtual visit, and we can talk about different prescriptions that can be used to help clear it for you.
Good. Now, I know you mentioned in your talk that we should be checking our skin every month. So do you feel like an annual skin cancer screening is sufficient with a professional?
Yeah, I think as long as the individual is looking at their skin once a month, then an annual exam with a professional is sufficient in most cases. For example, a melanoma patient may need to come in much more frequently than once a year. And that's something that your dermatologist would help you determine if you need to be seen more frequently. Or if you have a history of many skin cancers, we might see you every 6 months instead of every 12 months. And certain people really don't have a lot of activity on their skin, and we may say that you don't need an exam for 2 years. So it's really dependent on your individual skin, but it's always a good idea to get a baseline first, and then you can make that decision with your dermatologist about how often you need to be screened. In most cases, it's about once a year.
Okay. So do you have a website for Pinnacle Dermatology that you can share with us?
I do. So it is pinnacleskin.com, all one word. And we are a larger group. We have multiple locations throughout actually multiple states. But my specific practice is located right in Rochester. And you'll be able to find that information on our website.
Very, very good. Wow, this is really great. And thank you everybody for your questions. I learned a ton from them as well. So thank you very much, Dr. Clark. This was very informative. So I hope you guys can all spread the word about this recording and share it with your family, neighbors, friends, because I think there's some great information here that everybody can benefit from.
Well, thank you so much, Stephanie. It was a pleasure to be here this morning. Thank you everyone for joining.
All right, everybody, you take care.
Have a good evening, everyone. We'll hopefully see you soon.
Yes. Bye-bye.
Thank you.
Bye.